Hi guys, and welcome back to my channel. If you're new here, my name is Cody Kavita. I'm an actress and a voiceover artist here in Los Angeles, California, and I also have 5 chronic illnesses, which I manage on a daily basis. Hi. It's been a while. It's literally been a year. That was not on purpose. I did not plan on taking an entire year off of YouTube, but honestly, I have just been overwhelmed by my current health situation, and I've not actually talked about this condition on my channel before, mainly because I haven't had to. I've been in remission for quite a few years, but starting in June of last year, 2023, I felt kind of the hint that it might be back, and literally right after my wedding, September 2023, it was 100% back with a vengeance. Basically, I have a condition called endometriosis. It's a condition where tissue similar to the lining of the uterus is found outside of the uterus, in places where it doesn't belong, and it can cause a large amount of pain, like an unreal amount of pain. For me, my endometriosis was found underneath both of my ovaries, and it also destroyed my appendix, which is another part of this disease that not a lot of people talk about. It can attach to surrounding organs and destroy them. It can fuse organs together, and it can be really hard to remove without damaging organs. So it's a very scary disease that is very poorly understood. When it comes to my symptoms this time around, I've had just large amounts of pelvic pain, and not just around my cycle, like 24/7. Like, I'm in pain right now, and you just kind of get used to it. It's horrible, but the pain can go from a 2 to well above a 10. I have had many occasions where I pass out because the pain is so bad. You get really nauseous from the pain. It's really horrible. Another thing, of course, is chronic fatigue, because it's exhausting being in pain all the time. And this time around, something I'm experiencing, which I didn't last time, it's impacting my legs and my ability to walk. I have spent a large part of this year dependent on a cane and sometimes a walker. The pain basically shoots from my pelvis down to my legs all the way to my toes, and it's not consistent, which is very frustrating. Some days I'm totally fine not using any mobility aid. I can go to the gym and, do grocery shopping, but more often than not, as this year has progressed, I have become much more dependent on the cane and the walker. And when it comes to endometriosis, what is considered the gold standard of treatment is something called excision surgery. I've had this surgery before. I had it in 2020. That's actually how I was diagnosed with endo. And it has a really low recurrence rate. For anybody watching that's curious about excision surgery, I'll put some links below. And I'll also put a link to something called Nancy's Nook, which is a group on Facebook. Just life-changing. They really know what they're talking about, and they talk a lot more about excision surgery. For me, my first excision surgery bought me 3 years, which is pretty good. But even by excision standards, I guess is considered a low amount. So hopefully this time around will buy me quite a few more years. And in some cases, patients have excision and never deal with endo again. So I'm really hoping I'll be one of those. But yeah, I basically thought I would make a vlog to take you along for the process, show you what I'm doing before surgery, on surgery day, and also my recovery, and talk about my experience. For anybody out there that is dealing with endometriosis or knows someone with endometriosis, hopefully this video will help you feel less alone, and maybe you can take some tips and tricks from my experience and apply them to yours. So without further ado, grab yourself a snack or a coffee, and let's get into it. So something I'm doing this time around that I didn't do last time are bins, or stations, if you will. They're going to be strategically placed throughout my house, one at my bedside table, one in the kitchen, and one in the bathroom, but they are full of items that I might need. You do not have to get clear bins. I just am a sucker for a well-organized clear bin. But basically in these I have all the products that I might need. One for myself, so that I can grab things myself and I don't have to rely on my husband to come and get everything for me. It gives me a sense of independence, but also it is for my husband. My dear sweet husband Hill does so much for me. Like I mentioned, I have 5 chronic illnesses, and especially with the endo this year, he has really had to do a lot. He has to cook for me, he's had to drive me because the endo makes it really painful to drive. That is a lot for one person to take on and to keep track of. So I'm hoping the organization that I've done with these bins will help make his life easier and also help me help him help me. Yeah. So starting with the bedroom bin, what I have in here are a few items. First off, you don't have to do this. I just do this because I'm extra and I like any excuse to use my Cricut, but I labeled my medications for my husband to make them easy to read and figure out. I also put a list that's going to go right by my bed of all of the medications I'm taking, the dosage, when I have to take it, any warnings he needs to know, what they're for, things like that. I also have, this was essential last time, Ricola cough drops. The reason for these, when they put you under, they intubate you, and that tube, when it comes out, can really irritate your throat. If I remember correctly, it was like having just a really sore throat. It kind of hurt to talk, but what really got me was the coughing. And after abdominal surgery, coughing is just, it is awful. So these really came in handy, and I'm going to be using them this time around as well. Another thing we have is a thermometer because it's important to take your temperature periodically just to make sure you're not running a fever. And lastly, these are so funny to me. These are basically crib liners. They're actually quite large. I'm not going to open it all the way. But on one side it's absorbent, the other side it's plastic. This is for the bed. We have white bedding, and when it comes to endo surgery, sometimes you can bleed after. Luckily for me, last time I only bled in the hospital. When I got home, I bled just a little bit. It was nothing crazy, but you never know. So that's why we have these liners. And for a little cat mom hack, if you have a cat and you're doing this surgery, I like to use these in Charlotte's, what's it called? Carrier. I like to use it in her carrier because she's the kind of cat that goes potty on the way to the vet and the way back. So these do come in handy post-op. The next bin I have is the kitchen bin. These just have items in here that I found helpful last time and I think will help me this time. Starting with, so funny, prune juice. This is obviously for my bowels. When you have surgery for endo, they move your intestines around because obviously they're searching for endo, but that can also send them into shock. So it's a couple of days until you're able to go to the bathroom, but also some of the pain medications they give you can cause constipation. So this really helped last time, and I'm hoping it will help this time. Another thing I have, which I didn't need last time, and I'm hoping I don't this time, is mint tea. This is for nausea, because when you wake up from anesthesia, a lot of people get nauseous. I didn't, and I'm really hoping I don't this time, but it's here in case. Of course, I also have straws, which I'm not going to show you, but that can help too when you're post-op, so you don't have to lift anything. You can just slurp. You know what I'm trying to say. The last thing is very specific to me, and it's tuna. When I woke up last time, for whatever reason, the only thing I wanted to eat for those first few days was tuna. Nothing else sounded good, just tuna. So I have a couple packets here ready to go. I should mention, we're not doing any meal prep for this surgery, mainly because, and this might be specific to me, my appetite changes every day. I never know what I'm interested in or what I want to eat. So instead of potentially wasting food and energy, I'm just going to get stuff delivered if I feel like eating something. The last bin I have is the bathroom bin. Is the bathroom bin. As you can see, we have here pads. You can obviously choose what works best for you. I just like this brand. And that is because, as I mentioned, you are going to be bleeding post-op. But another thing I have in here are these guys, and they are game-changing. These are postpartum underwear. I'm going to show you. They look massive, but you will see once I am post-op that they're the perfect size, because something they do when you're under is pump you full of gas. That's so that they can see everything. in the abdomen, and that gas takes a while to leave your body. If I remember correctly, for me, it took me, I want to say like a month for the gas to completely be gone. And so during that time, wearing regular underwear or pants is just nearly impossible. So these really came in handy. I like these ones specifically because they're reusable. You can wash them in the washer, and I'd recommend air drying because I did one in the dryer and it disintegrated. So air dry them, and then you can use them again and again. Of course, I will link all of these items below. So in case you're interested in buying the exact same thing, you can. The next thing I have is gauze pads and medical tape. The reason being, when my surgeon closes my incisions, she uses steri strips, but then she also covers those with gauze to keep them protected and clean. So I like to change my bandage every day, one, so I can clean things, but also see how things are healing. So these are wonderful for that. And then this, a lot of hospitals will ask you to wash with Dial soap ahead of your surgery. I was asked to last time, and for some reason I'm not being asked to this time, but I had already purchased this, so I'm gonna use it. But yeah, Dial soap. And then when it comes to staying clean, after your surgery, at least for me, it took me a few days to be able to shower, and even then I needed help. Like, my husband had to do everything. He had to wash my hair, scrub me down, all of that. So to kind of prolong the feeling of freshness, I got flushable wipes, which I should mention, I live in an old house. We do not flush these because they will destroy our pipes, but flushable wipes, and then also dry shampoo. I'm hoping these will help because for me, I really do not like feeling unclean. So you know, obviously mental health is important when you're recovering from surgery, so hopefully these will contribute to that. But yeah, that's basically everything that I have prepped. I'm gonna probably put you in a musical montage for the next couple of days leading up to surgery. I think today's Sunday, my surgery's on Thursday. Tomorrow I'm getting my nails done because another YouTuber on here, her name's Lauren Norris, I'll link her below. In her endo video, she got her nails done, and I was like, that sounds great. So I'm gonna do that pre-surgery so that I don't have to worry about doing my toes post-op. And then also on Tuesday, I have physical therapy, which something I don't think I mentioned. I've been in physical therapy every week to help with the endo, and like I said, this disease really impacts every part of your life. And so yeah, having a weekly recurring physical therapy appointment is part of that. And also I do physical therapy myself at home every day as well. So yeah, it's a really I don't even know how to describe it. It's an overwhelming disease. So I am looking forward to having my surgery and hopefully feeling better. So yeah, I guess the next time I talk to you will be morning of. Oh my gosh, it's kind of scary, but I'm excited. Yeah, I'll see you soon. Good morning. Hi. It is the morning of surgery and I'm pretty much ready to go. I have in my glasses because you can't wear contacts for surgery, and I didn't mention this before, but when I got my nails done, I just got my toes done because you technically can't wear nail polish on your fingers. So I actually don't have any nail polish on my fingers, but I just wanted to make that clear. This is what I'm wearing to the surgery center. It's just a simple little t-shirt dress. Got it from Old Navy, I think for like $11. It was on clearance, which is great. I actually got 4 of these in different colors, but this one is the larger size. This is a medium, I believe, because of the fact that my stomach will be so inflated, and I want to have absolutely nothing touching my stomach on the way home. But yeah, I'm gonna go ahead and set the bed up, and I think we'll be on our way. So excited. Okay, so here is the bed ready to go. This wedge pillow is great, especially the first few nights, because you can't lay flat. This is great because it props you up. I got this at Target. I'll link it below. Of course, I have my heat pack ready to go. And then I have compression socks here, which I will probably wear for the first day, maybe 2, just to help with circulation and prevent blood clots. Of course, we have an old towel here, but underneath that old towel is the mattress protector for hopefully not for when I bleed, but just in case. It's all there. So yeah, the bed is ready to go, and I'm gonna hop in the car. Hi, I'm home. The surgery went well. My throat is sore. I'm waiting for coffee to warm it up here. My incisions are in the same place as my old incisions, so that's great. I'm not in pain right now. I was at the hospital, but they gave me extra pain medication, and I was actually nauseous when I woke up from anesthesia, so I have a patch on the back of my neck for that. But yeah, Charlotte's worried about me. You're not worried about me, Hato?
No.
Yeah, I'm really happy. Hi, baby. She was like this last time. It's like she knows something's wrong, so she wouldn't leave my side. But yeah, day 1. Oh, also, I got sent home with pictures this time in color, and a lot of problems on my left side, so I feel really validated right now. Yeah, I'm really hungry too, so I'm gonna have coffee, and Till got me a chocolate croissant, and that sounds really good.
Hey baby, time to wake up. Hey my love. Good morning. It's really full. Sorry. Yeah, careful please. Like it should be drinkable, but it's...
Hi. So it's day 2. I am feeling so much better. I only needed one of the heavy-duty painkillers last night at midnight, really more so that I could sleep through the night, because I know pain tends to wake me up. I just took one right now at 11:15, just to give you an idea of how much pain I'm not having, which is lovely. I think today my goal is to walk around the house, or as far as I can, and just continue getting the gas that they pumped me with, getting it moving and getting it out. Yesterday was lovely. All we did was sit here and we watched Over the Garden Wall. This one slept on my legs all last night. It was really sweet. And she didn't go up to my stomach, which is where she usually likes to be. It's kind of like she knew, which was really sweet. So, yeah, right now I'm doing some Pinteresting. And then I guess I'll get on with my day. Till's going to bring me some banana toast, which I love. Alright, so for breakfast I'm having some bananas on toast with hemp seeds and I think honey. I had this last night as well and it was so nice and easy on my tummy. Till's getting a tea for me because my throat still kind of hurts from the intubation, but overall I'm surprised at how well I'm doing. Granted, I did take painkillers, so that probably helps, but I was able to go to the bathroom by myself. I was able to walk back from the bathroom to the bed and climb into the bed. Till was spotting me the whole time, but I didn't really need any help. It was really great, and yeah, I'm really happy with how this recovery is going so far. Hello. It's day 3. Yesterday went really well. I didn't really document much of it because all I was doing was sleeping. But I was able to take a shower. I needed help, but I was able to do it. And I think, as nice as that was, I think I overdid it because today I'm feeling kind of worse. So I think I'm just going to focus on resting today. And I'm still going to do my walks around the house. We were going to try and go outside, but I don't know if I'm ready for that yet. And then I'll probably try and do my nails. But other than that, like, I feel okay. Healing is definitely not linear. So I'm, taking it easy. Also, I haven't taken a painkiller since yesterday at like 6 p.m. and it's 11 o'clock now this morning, so that's good, I guess. But I'm not like trying to see how long I can go without one. If I have immense pain, then I'm going to take a painkiller, but I'm not having immense pain, so that's really great. But yeah, day 3. I realized I never showed you what the postpartum underwear looks like, especially when you're bloated. So I'm going to show you. Like I said, it's gigantic, but it is the perfect size because that's how bloated I am right now. And I got a size higher than, like what I thought the large was, I got a size bigger than that. Because the looseness here is essential because this is all bloat and it hurts really bad. And the ones they sent me home in from the hospital were actually a little too tight and they were pressing right here, which really hurts because that's where my incisions are. As far as my incisions go, they are healing nicely, but they're starting to itch, which, is a good sign. That means they're starting to heal. But yeah, so this is why I say getting a size bigger than you definitely need is essential because this feels so much nicer than what I had at the hospital. Hello, it is day 4. I'm gonna be honest, I'm not having a good time. I'm really uncomfortable. Last night was very painful, and today has been quite painful. I don't think I mentioned that the gas that they pump you full of can cause shoulder pain. I didn't mention it because I didn't have that problem last time. I'm definitely having that problem this time, And so my shoulder is like right here and right here, and also like my upper back is so painful and so uncomfortable. So I'm dealing with that. Also, as I mentioned, your intestines take a while to wake up after surgery. Mine haven't woken up yet, so it's making eating a challenge, very hard. Yeah, so it's definitely more up and down this recovery versus my last surgery, but you know, it's a 2 to 3 week recovery period for a reason. So I'm just gonna take it slow and take advantage of the fact that my husband Till is here. He's here for the entire week, 24/7, and even in week 2, he's still pretty much gonna be here, leaving occasionally for certain gigs. But I'm just really lucky to have his help, because even on day 4, I still need a lot of help to do things, which is it's frustrating. I'm a very independent person, so it's been a challenge. But anyway, so we're gonna try and go for a walk outside, because the weather looks really nice, and I feel like going outside will be good for my mental health, versus doing my walks throughout the house, which is fine, but change of scenery. So yeah, that's day 4. Again, it's just different than last time. Last time it was each day I got better and better, and this time it seems to be going woo, 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 like that. So keeping it positive. Hi, I'm alive. I did it. I survived. It is 2 weeks post-op, and I feel so much better. That was a really rough recovery. Yeah, I was not anticipating to have such an up and down recovery. It was quite tumultuous. It really wasn't until, I want to say, like day 6 that I started to feel just a little bit better, and thankfully from there it just continued to get better. But yeah, a lot of back and forth, a lot of up and down. My intestines did finally wake up on day 5, which was such a relief. That is so uncomfortable. And as far as bleeding goes, I did have some bleeding at the hospital and when I got home, but then it kind of stopped after the 2nd day. And then out of nowhere it started again, and it started to be at a point where it got kind of scary. And I checked my post-op packet, and it was within the parameters that they said before I should freak out. So I tried not to freak out, and thankfully it just kind of cleared up on its own. But from what I've learned today, that is just to be expected as I recover, which is interesting because it didn't happen last time, but it is happening this time. So, but yeah, as far as how I'm feeling, wow, I don't even know where to begin. I can sit up straight. I can stand up straight, actually, which is something I haven't been able to do without pain or difficulty in over a year. Yeah, I can't remember the last time I was able to do it without problems. Another thing, I'm walking. Yeah, I'm walking without any difficulty, without any pain. I haven't needed my walker. I haven't needed my cane. Nothing. It's been really nice. And yeah, basically as far as pain goes, I am still having some pain, but we think it's post-op pain, and I'm going to continue having pain probably for the next few months, but it's not nearly to the level that it was before my surgery. The thing that really surprised me was the amount of toast I had. Just plain white bread toast. It was just so nice, so easy on my stomach, and I ended up craving that most of the time. So guess you never know what you're gonna want. My best friend Leslie actually stopped by a couple of times, and she also cooked for me on one of the days, which was such a treat. She also brought me a really sweet note, and I wanted to share it with you. She made it, first off, and this is the yellow awareness ribbon, which is the color for endometriosis. But it's what she said inside, and I am gonna keep the majority of it private because it is a private note, but it's the last line. And it was something I didn't realize I needed to hear. And if you have endo or you're going through this, like, it might be something you need to hear as well. P.S. I'm sorry you have to be so strong. That just hit my soul in a place that I didn't think needed attention, but it felt so good. And I think if you have a loved one with endometriosis, sometimes it's easy to forget that We deal with this every single day, and yet we are still expected to show up. And we do. We do show up. And there are days when we are expected to show up and not make it look like anything's wrong. And that is really hard. That takes a lot. I also happen to have my follow-up appointment today, and I thought I would share with you, one, what they found, and then two, what they didn't find. Starting with what they didn't find. Endo. Yeah, I know. This video is literally titled Endometriosis Surgery, and I'm going to keep it that way because what they did find is an unfortunate byproduct of endometriosis and endometriosis surgery, if you will. Basically what they found is something called adhesions. I will put a link below to explain what adhesions are, but the easiest way I can explain it is rogue scar tissue. I mentioned early on at the beginning of this video that part of endometriosis is that it can stick your organs together. That's partly because of the adhesions, which is exactly what was happening with me, which explains so much. Like I mentioned, I couldn't sit up straight without difficulty, and also when I would lay on my right side, it always felt like something was tugging and pulling on my left side. It was very uncomfortable. And of course, now that we know what was going on, it makes so much sense. Basically, the adhesions this time around had pinned my left fallopian tube to the side of my pelvis, which is not where it belongs. So they had to detach that and put it back. But it explains why it was so difficult for me to move, because everything was essentially being held in a very unnatural position. The other part of it is the adhesions were unfortunately part of, or a result of, my previous surgery. Which is something that can happen with endometriosis surgery. Like I mentioned, first time around, endo was found underneath both of my ovaries, so behind my left ovary, so like the back of my pelvis, I think they call it the posterior cul-de-sac, they found a lot of adhesions back there, which also makes so much sense when it comes to my walking and how it was impacted, because back there is your spinal cord, there's a lot of nerve endings back there, and the theory is that those adhesions were kind of tapping into those nerves, and that's why I was having all the issues I was having and why I'm not having those issues now, which is such a wonderful thing. That is what I was hoping for. Now, I'm going to be fully honest here. I did go through a bit of a identity crisis when they said it wasn't endo, because as someone with chronic illness, I really pride myself on, and it's also important, that I know my body. So when they said it wasn't endo, I was like, whoa, hang on. It felt exactly like endo, because endo pain is not like any other kind of pain. And so it was really nice talking with them today, because they basically explained it that, one, where they found the endo, or where they found the adhesions, where they found the adhesions, that was where they removed my endo last time. So it would make sense that I was having the same pain because it was in the same location. So yeah, I'm not gonna lie, it was a little upsetting to hear that it wasn't endo, but it was also really nice to hear that it wasn't endo. It's nice because as of literally last week, I am 4 years in remission from endometriosis, which is awesome, right? But it was also a little upsetting because, one, there is a very small chance that there is endo there, but that it's microscopic and it's not at a place where it can be excised, but it can still cause issues. So there's that thought, but then also the adhesions. Some patients get them, some don't. It appears I am one that does, which sucks, because it potentially means I'm going to be back here again at some point. So basically, what's next for me? Well, I am going to be starting on hair supplements. This is the brand that I'm choosing, not sponsored at all. It's the brand I used last time that I had surgery, because if your body is anything like mine, it kind of freaks out after surgery or after any type of like major flare-up, and I tend to lose my hair. So I'm getting ahead of it this time, and I'm going to be starting on this. I'm going to be starting on it tomorrow, because tomorrow morning I have to get my blood work done for my endocrinologist, which I'm seeing next week. Yeah, with 5 chronic illnesses, it never ends. Never ends. So I'll be starting that tomorrow. The other thing that I'm going to be doing, once my incisions fully heal, they're almost healed, 2 of them still have a little bit left to go. But once they are healed, I'm going to be starting on scar treatment. Again, not sponsored. I just used this brand last time and it worked really well. This is Scar Away. They have a silicone gel option and they have a silicone sheet option. I found myself using both last time, and I'm probably going to use both this time because you can kind of alternate depending on what your plans are for the day. The silicone sheets are really nice for on the go, and the ointment is really good for if you plan on being home, basically. At least that's how I found it to be. The next thing that I'm going to be doing is continuing with physical therapy, pelvic floor physical therapy, but we're also going to be adding on physical therapy for basically my general muscles. Because of this disease and the way in which it was causing me to hunch over, my muscles basically adapted. So some strengthened and some weakened. And now that I'm able to stand normally and walk normally, we need to, you know, restore the balance of my muscles, basically. So I will be doing that. But yeah, just basically monitoring it and listening to my body. And, you know, I'm really thankful to, you know, have a restart, if you will, and be able to get as much accomplished in these next few years that I can. Like I said, it sucks that it might come back, but that's just part of it, you know. I really don't have a cheerful, hopeful thing to say about that. Just that, you know, I think it really comes down to your care team, which is why I will say one more time, Nancy's Nook, please look it up, because I think because of my care team, that's why I'm able to, you know, every few years go have this surgery and then go and live my life, because they are at the front lines of this disease. They're the ones doing all the research, and the thing I like about my hospital, it's a teaching hospital, so they're teaching future endo specialists, which is so important. And again, just really thankful for the care team that I have at Cedars. That was really the nice thing about today with my follow-up. I had so many questions. Never felt rushed. They listened to everything I was asking. They gave me an answer for everything, and it was just, it's nice to feel like a person instead of a patient, if that makes sense. So, yeah. I'm gonna leave this video here. Thank you so much for watching. If you like this video or you found it helpful, please like and subscribe and hit the notification bell so you don't miss when I upload my next video, which, yeah, I'm gonna be uploading videos again, which I'm so excited about. Anyway, thank you so much for watching, and I'll see you in the next one. Bye!